Thank you everyone for joining today. Today in the Digital Health Seminar Series, we will have Alfredo Vellido talking. Before we introduce him, let me, when I go here, let me mention what is this Digital Health Seminar Series. This is an event that we organize every 2 weeks at the University of Bristol. People can attend online as well. You just need to register on Ticket Tailor if you are interested. The purpose is to connect people around academia and industry. We have a network in the Leap Digital Health Hub of industrial partners and other collaborators who receive this event every 2 weeks, and sometimes they join online. As you can see, there are some people online already. But this is also an opportunity for people that is around in person to join and discuss current research or potential ideas. Then this is happening every Tuesdays. This is basically the team that organizes these events. This is after this session, there will be one final session this year or this academic year, and then we will restart in September. Then some housekeeping. If you are in person, you don't need to register to a tablet, as it says there. We are just keeping track of how many people attend, and that's enough. Just for you to know, this session will be recorded, and we will make this recording available online. If anyone is not happy with that, please let us know, and we can remove you or do something about that. We have a YouTube channel in which we have those recordings. For the online attendees, you should be muted automatically, but yeah, if that's not the case, please mute yourself during the presentation. We will have some time at the end of the presentation. The presentation should be 40 minutes, more or less, and then at the end we will have 10 minutes questions and answers, or up to the end of the hour. If you are online and want to propose some questions, use the question and answer option, or just write your question on the chat. If you want to ask the question yourself, just let us know, and we can unmute you and activate your camera if you want. Then today we have Alfredo Vellido from Technical University of Catalonia. He was a professor of mine back a long time ago, probably 2012 or 11, something like that. And I really enjoyed his sessions about computer vision in that case, and neuroscience a little bit. It was a mixture of neuroscience and what is the similarity with convolutional neural networks and other types of networks, which was very insightful, and probably one of the reasons I was interested on neural networks later on during my master's degree and my PhD. Alfredo Vellido is going to talk about the impact of artificial intelligence in the healthcare sector. He's a full professor of computer science at the Universitat Politècnica Catalunya. He's a founder and board member of the Spanish Society of Artificial Intelligence in Biomedicine. He's a member of the IEEE Data Mining and Big Data Analytics Technical Committee, and some of his research interests are on medical applications of machine learning. And he's the chair and working on some topics of explainable machine learning and medical data analysis. Then, without further ado, let's welcome Alfredo.
Well, thank you so much. Thank you so much, Miguel. I'm glad you still remember the computational neuroscience classes. That's a good thing. Okay, if you stop sharing your...
No.
Okay, thank you, and I will share mine as well. Okay. Here we go.
Perfect.
Can you see it now?
Yes, I am trying to full screen here on the session. Yeah, then the floor is yours.
Okay, well, first of all, thank you so much for the invitation. It's always very nice to be back in the UK, even though I'm not there in person. But I hope even being online, it will be worth having something at 2 p.m. in the UK, which after lunch is always a different thing to do. I'm glad to have been invited to this digital health seminar series. The point is, I've been working on medical applications of artificial intelligence, and in particular, medical applications of machine learning for 30 years. That's a long time. I started in 1996 when I joined Liverpool John Moores University up there in the Northwest. And I did start I didn't know anything about machine learning. I didn't know anything or almost anything about biomedicine. But, the way things are done up there, I just joined a research group that was working on machine learning applied to neuro-oncology. And, I kind of started to learn as not only to learn about the fields, but learning about doing research. Since then, almost without interruption, in one way or another, I have been doing research in machine learning applied to medicine. And right now, I've been leading from 2005, over the last 20 years, I've been leading research projects related to that in different areas of medicine at Universitat Politècnica de Catalunya, in my department, which is the Department of Computer Science. By the way, I'm not a computer scientist. I'm a physicist by trade, but I'm a bit of an outlier in computer science, but still, my interest in machine learning has always been there. And I do research in the areas of oncology, nephrology. Now we have projects in ophthalmology, also in psychology and psychiatry. We have been covered quite a few domains, quite a few medical domains. And, unsurprisingly, the interest in the use of machine learning and artificial intelligence in medicine has been increasing quite widely, a lot, I would say, over the last decade, right? And in fact, one of the, I belong to the soft computing research group, but I also belong to the IDEAI-UPC, which is the Intelligent Data Science and Artificial Intelligence Research Center. This is a kind of supergroup, if you wish. It's over 60 senior researchers plus an ecosystem of PhD students, master's students, etc. Support researchers, postgraduates, etc. And basically, it was created 8 years ago because precisely that, because we were getting, let's say, so fashionable again that we needed a kind of integrated single door for all the people doing artificial intelligence at UPC. So we created this center so that people could knock our door. And one of the areas, it's divided in different areas. We have Industry 4.0, we have education, we have even agriculture, but one of the main areas we cover is actually biomedicine, right? So let's say I am quite invested in this area, in this domain. But let me cut to the chase. You might recall this is a piece of news from the New York Times 4 years ago, actually almost to the day. This is from the 12th of June, 2022. There was this fancy piece of news that said that in Google, they were experimenting with artificial intelligence and with these new large language models. And there was this Google engineer, Black Lemon, who thought that the model he was dealing with, a model that at the time was called Lambda, he thought it was sentient. So given that it was sentient and he was convinced about it, he thought, it shouldn't be shut down. It should be treated as, let's say, almost a person. At first, this piece of news was kind of, okay, some other weird nerd out there in Google. But then, it kind of rang different, you see, from other pieces of news. Why Why are we knowing about this? Are they actually dealing with something that resembles actual intelligence? I mean, that this was in the air. So there was, if you recall, as I said, 4 years ago, so probably all of you remember, I mean, there was a bit of a, controversy related to this. Very quickly, people precisely from the computational neuroscience field, people like Gary Marcus, some of you might be familiar with this name, might ring a bell, they said, well, no, I mean, this model lambda is not sentient at all, not even slightly, as he says in this Substack reply. And other people agreed with him, saying, we have arrived at peak AI hype accompanied by minimal critical thinking. Well, obviously, what we know now, with the perspective of 4 years, is that definitely it was not peak AI hype. I mean, we are still going up the peak, up the slope, and the hype surrounded artificial intelligence. Well, now it's it's quite literally impossible to avoid. Yeah, and as someone who has been doing research in this field for 30 years, it's kind of strange. And even right now, and part of what I'm gonna be saying today has to do with this. Even right now, when I say to people, well, I work in artificial intelligence, the feedback is not always positive. Because what I used to get was like, oh, well, how fancy, you are working on artificial intelligence. Right now, sometimes it feels like they are thinking, well, you are one of the bad guys, who are kind of taking over the world, which thank God is not the case. But anyway, I mean, this controversy from 4 years ago, I mean, we have now become accustomed to it. But at the time, it was like, I mean, from the point of view of data scientist, like in my case, it was like, something different is kind of happening. But I mean, we have right now really a big problem. And I have taken the liberty to translate one of the vignettes from this um, comic stripe artist in Spain, El Roto, a really, really insightful guy, who published not long ago this vignette, artificial intelligence demolition area. Yeah. We are now in a situation in which artificial intelligence is literally taking a cognitive effect on each of us and on society at large. So I am quite accustomed to give talks to people in the medical area, to medical experts. I know people from oncology invite me, okay, talk about artificial intelligence. What could artificial intelligence do for oncology? And I go and give a talk, or pediatrists, or pneumologists, or whatever. So whenever I talk to them, I find myself in the situation of trying to explain exactly what we are dealing with, And we have two big problems with artificial intelligence. The first one is artificial, right? Because when people think we are dealing with something akin to human intelligence, it's very difficult to make them understand that we are dealing still with an extremely artificial thing. Most of the things artificial intelligence still does is mostly guided by humans. And we cannot fool ourselves and ignore human agency here. So some people, even especially from the area of computational neuroscience, consider that there is nothing that can be compared to animal intelligence because of the lack of biological substrate. So many people think that unless there is biological substrate, we are not talking about intelligence in the sense we understand intelligence in animals, not just in human beings, in animals in general, with a central nervous system. So from this, obviously, the second problem actually is when I started doing research in artificial intelligence, the term artificial intelligence was completely unfashionable. It was out of fashion completely. I mean, it was. I mean, if you told people you were doing artificial intelligence, they would think, well, it was you are an old-fashioned guy, right? And artificial intelligence now has become, center stage. It's up there in front of all of us. But the point is, we talk about artificial intelligence as if it was an intelligence. The problem being, we don't know much about what intelligence is, biological intelligence. And in fact, we are quite far away from understanding even some basic aspects of it. I don't know if you're aware, but only 3 years ago, less than 3 years ago, finished one of the biggest European research projects ever. Yeah, a flagship European project called the Human Brain Project. The Human Brain Project, as its main goal, had the idea that we could understand human intelligence, but at different levels, from the genetics all the way to the functions of the brain. Yeah, and it was a 10-year project. It started in 2013 all the way to 2023. Well, now we can say that it was not much of a success, really, but they got funding. The funding they got was like almost close to 1.2 billion euros. Yeah, so around 1 billion pounds. That's for research purposes, that's a massive amount of money. Yeah, 10 years, whatever, massive amount of money. And even though we only got marginally closer to understand how the brain works. In fact, one of the main outcomes of the Human Brain Project was a human brain atlas, just to clarify exactly what is what in the brain. A connectivity map of the brain, an atlas of the brain, I mean, still extremely far from understanding the inner workings of the brain. Doesn't mean we don't know anything about it, but we are really, really very far to understand biological intelligence. Therefore, it's a bit silly to be talking about whether artificial intelligence is intelligent, because we really don't have the tools, the means to compare it. Yeah, you may say it looks like biological intelligence, it acts like human intelligence, and that's fair, because in the end, one of the criteria we have for assessing whether a machine is intelligent is the Turing test. And the Turing test is basically about linguistics. It's if I have a conversation with a machine, can I identify that it's a machine? Yes or no, right? Right now, we are in a point in which obviously the Turing test is over, is being passed. Does it mean we have intelligent artificial intelligence? We don't have a clue, right? But according to how they work, and we know how they work because they are artificial and we made them, there is nothing that resembles that much biological intelligence. Maybe a different type of intelligence, maybe, yeah. But for that, we should kind of broaden up the concept of intelligence. Anyway, so as I told you, what I try to say, many of these medical experts, is curb your enthusiasm. Everybody's, up for grabs in the medical sector, trying to use artificial intelligence, trying to see how they can apply it, how they can integrate it in their workflows and guidelines, etc. But you have to be extremely careful. I mean, what I recommend is that ignore the hype, try to work on realistic things, and try to focus on what's important. Yeah. In fact, some people also need, probably not you, but some people in general need some context. I put it usually in the metaphor of the 3 waves. I mean, we live in a fully computerized and digitalized world, yeah, moving towards real IoT. We also, because of that, live in a completely datafied world in which almost anything we do, any context in which we are, generates data. Yeah, so it's like heaven for data scientists, if you want. But data science exists because now we have the sort of data and the amount of data and the quality of data, for everyday things that we didn't have 10, 20 years ago, right? And related to this, although it might seem a bit more marginal, but not that much, the fact that open source software has, let's say, gone to the fore in anything that has to do with data science. I mean, right now, most people with basic technological background can access these tools for free, play with them, and do things with them. And that goes from basic machine learning all the way to the latest free large language models. Well, not free, open source. That's the most important thing, open source. So anyone who wants to do some data science, some machine learning, applied machine learning medicine, the entry barrier, the barrier for entry, it's really low. The threshold to be able to use these type of tools is now very low. So this is also an important thing too. But one of my main concerns is that people understand that the focus is on the data themselves more than on artificial intelligence. I mean, we can use artificial intelligence the way we do it because the access to data is everywhere. Yeah. And data science exists because of that. And this you're seeing your screens is just a basic example. Sabina Leonelli, an Italian science philosopher. I mean, she has published a few things making these things very clear. This book called Data-Centric Biology, a Philosophical Study, in which she explains very clearly how biology as a basic science has changed because of the way we deal with data. And this very interesting short article that I strongly recommend, Data from Objects to Assets, published in Nature 7 years ago, roughly, a 4-page paper that explains the history of data and why data is so much more than the data themselves. The political power, the economical power, the societal power of data beyond themselves. I strongly recommend this reading if you're interested in the topic, obviously. But the point is, it's not just access to data, it's the enormousness of it. It's the huge size of data that some domains related with biomedicine deal with. I mean, these are data from a European but UK located institution, the European Bioinformatics Institute. In 2012, these guys were dealing with around 10 petabytes of data. Only 4 or 5 years earlier than that, they might be dealing with 1 petabyte. But by 2018, they were dealing with 160 petabytes of data. Think about that. I mean, these are basically biology-oriented people. It's bioinformatics, but people used to wet labs for biology, and suddenly they have to deal with this enormousness, this mastodon of data. How do you deal with that? Not just how do you analyze those data, but how do you deal with them from a management point of view? Where do you store them? A single human genome is 140 megabytes, something around that, And these guys get tens of millions of requests from human genomes every day. How do they deal with that? They need infrastructures made to measure just to deal with it, right? So this is the context in which we are working. But also from the point of view of artificial intelligence, we have to bear in mind that we are living a kind of wet dream of connectionism. Connectionism is the theoretical basis of artificial neural networks. The way that intelligence can be simulated in a distributed way by optimizing some loss function, over a nonlinear function. I mean, this has been around from the 70s, from the 1970s, 50 plus years now. Well, maybe 40 mostly, because the 80s was when connectionism went ballistic. Yeah. But what we have right now with us is deep learning, which is a kind of connectionism gone massive. Yeah. With these new models, including all families of autoencoders, transformers, etc., but which are at heart connectionist models, artificial neural networks. Yeah, the difference here is not about the models and the techniques themselves. It's about who is in charge of them, and this is why I talk about post-Fordism here. There are very strong economical implications and therefore societal implications. The people who are developing these models, the people who are at the bleeding edge of it, are IT companies, not academia any longer. And this has been like this for almost 20 years now. I mean, deep learning brought all the academia, or some important parts of academia, towards these companies. And these companies are right now the ones who are really taking us somewhere else. Yeah. So, I mean, this has very, very strong implications. I first realized about the potential impact of all of this around 2017, 2018. I was at NIPS, the conference now called New RIPS, in Long Beach, this was 2017. And we had a workshop there, but I also saw this other workshop called What Parts of Healthcare Are Ripe for Disruption by Machine Learning Right Now? I thought, whoa, this must be interesting. But then again, I thought, ooh, healthcare disruption in the same sentence, dodgy. It's like I wouldn't want my healthcare system to be disrupted. I want it to evolve. I want it to get more resources, etc. But disruption. So I thought, well, who is behind this special session, this workshop? Well, and the people behind this workshop were actually people from Microsoft and Google DeepMind. Yeah, names that it might even ring a bell. Mustafa Suleiman from Google DeepMind, Jennifer Chayes from Microsoft Research, New England. So I is really that interested. It's healthcare such a business, so that at the time, I didn't think it could be that much. But then I realized, no, I mean, these guys can really make a huge amount of money out of this. If they offer the medical sector, the healthcare sector, tools to analyze the data they generate, and obviously the healthcare sector generates lots of data, they can trap them economically. This is happening in education as well. Now most education systems, public education systems, are trapped by these technology companies because they get free tools in exchange for data. As simple as that. I mean, we as a university have a contract with Google because Google is offering us mail services and cloud storage services, etc., at a reasonable price. We don't have to develop them ourselves, and they are Google's, so they are probably much more robust than anything we could develop and much more advanced. So we fall in these traps, and suddenly we are flooded with their own products, but we get captive by their own products, and they get the data. You could think there are agreements so that those data can only be used in certain terms, but hey, So at this time I thought, well, we better get social. Think about the social impact of all this we are doing. I mean, so far, as someone doing applications in medicine, I was vaguely aware of the social impact, but it was very indirect. Then I thought, well, no, I mean, this is pervasive. I mean, this is everywhere. The impact, the social impact is going to be everywhere. And I give you an example from the UK. This is from The Guardian, 2018. Yeah. This piece of news. Councils use 377,000 people's data in efforts to predict child abuse. I thought, cool. I mean, that's a very interesting social application. But then I took a step back and I thought, hold on a sec, councils using this massive amount of citizens' data, what about privacy and anonymity, you know? Can they play with this data even if the objective is important? And then again, I thought, well, what happens? I mean, given that this is an extremely sensitive topic, what happens if things go wrong? What happens about false positives? You know, a family is targeted as potential child abusers in their own household, and they are not a false positive or a false negative. You know, a family that should have been targeted as a potential risk for their child, for their children, and they are not identified as potential abusers. So what could go wrong? Everything, you know, and even more. Some of the councils involved, like Hackney, Thurrock, they didn't develop their own software and their own systems. This is before large language models, right? It's 2018, yeah. And Hackney and Thurrock, for instance, they hired a private company called Shantura, yeah, a company that has received awards because of their socially important innovation, blah, blah, blah. But think about it. Data, sensitive citizens' data given to a private company to predict something as difficult and as sensitive as potential child abuse. So it was around this time that, as I said, I became aware of these awful potential social implications. The Guardian even wrote an editorial, which is very unusual about technological issues. They wrote an editorial, their view on artificial intelligence in social work. Algorithms don't have all the answers. Yeah? So something was kind of brewing. And then I started to think a bit more systematically about it, and I realized that there were a few topics that we people who apply artificial intelligence in medicine should be aware of. Legislation, explicability and interpretability of the models, privacy and anonymity, ethics and fairness, and even more importantly, altogether, you know, the mix of all of it. Because these things, this aspect, these social aspects of the potential use of artificial intelligence in public, they don't come on their own. They usually come in pairs or all together. You know, privacy and anonymity has to do with explainability and has to do with legislation and ethics, etc., etc. But, well, in case you're interested in what I thought about it, I wrote a paper about it, Societal Issues Concerning the Application of Artificial Intelligence in Medicine, published in the journal called Kidney Diseases, because I was working in nephrology at the time, and they were interested in these kind of topics. If anyone wants this paper and cannot get it, I'm happy to send it to you. But altogether, you know, the bottom line of all these aspects of social impact is that they can take any form, but in the end, they somehow make important that we design the machine learning, the artificial intelligence models with a human-centered perspective. Yeah, incorporating, therefore, human relevant requirements and constraints. Yeah, we cannot just develop machine learning models and apply them to social data or data that for one reason or the other is going to affect people just like that. I mean, thinking only on the technological prowess and how accurate my models are, etc. No, you really have to take all these things into account. Let's go one by one, okay? The first one, reasonably easy to deal with, is ethics and fairness. Yeah, the main problem here, and not difficult to understand, is the fact that machine learning models, artificial intelligence models, have never, not until now, and not even now quite, yeah, they have never been thought from this point of view, right? We designed machine learning models that are capable of predicting well, forecasting well, classifying well, segmenting well, whatever. Yeah, but we don't usually design them with ethics or fairness as one of the elements of our design. Yeah, one of the constraints of our design, which is funny because if you think of human intelligence, ethics is the sort of set of guidelines that allow us to have biological intelligence in society. Yeah, one of the main aspects of biological intelligence is that it happens in society. It's individual intelligences interacting with each other and growing because of that. You know, intelligence evolves in social contact, right? And ethics is like a kind of basic set of self-imposed guidelines to interact in that way. But this is not, has nothing to do with the way we have designed our artificial intelligence models. Anyway, at this point, we really need to, because an area of medicine, like medicine and healthcare, areas like this have always taken ethics and fairness as an important issue. I would say even a central issue. The Hippocratic Oath, it's all about ethics and how a doctor should behave with his or her patients. Yeah. So ethics has always been an integral part of healthcare. How do we match that with an artificial intelligence that has not been designed that way? Well, it's not that there have been no recent efforts about this, especially at the European level. Lots of efforts about integrating ethics and AI. There was a European Union high-level expert group on artificial intelligence that created some ethic guidelines for trustworthy AI a few years ago. There was also the AI for People project that investigated in detail the ethical implications of artificial intelligence and machine learning practice. But if you check their guidelines, they are completely lacking specification. If you, for instance, look for things related to healthcare or biomedicine, you won't find anything at all, anything relevant. Yeah. And the devil is in the detail here. I mean, for medicine, we need, something that tells us how to design ethical, machine learning, artificial intelligence systems in this context. How to create artificial intelligence and machine learning-based decision support systems that are not affected by bias, for instance, ethnicity bias or gender bias or other types of bias. This lack of fairness is obviously an ethical concern, but it's extremely difficult to deal with because mostly it doesn't have to do with the artificial intelligence methods. It has to do with bias already integrated in the data. Yeah, and that's an especially difficult thing to deal with. Probably you have all seen this. This is an example, simple example of a few years ago. This was a Google automatic image tagging machine based on artificial intelligence that you gave the machine an image, automatically tagged it with labels, from the top left, skyscrapers, okay, airplanes. This is a difficult one. It took me some time to realize this was a wing of an airplane. Cars, okay, bikes, fine, gorillas. Oops. You don't want to see your friends tagged as gorillas, So, I mean, this was reported to Google in the very initial stages of development of this system. Yeah, and Google, these things tends to take them more or less seriously. I mean, they don't ignore them. They, in that sense, they tend to behave a bit better than other technology companies. But the important thing with this case, beyond the anecdote, is that the only way they managed, and this was 3 years later than this problem was, this bug or glitch of the system was reported, the only way they managed to deal with it was by removing gorillas from the database. That means basically that Google couldn't find a way out of it. And if Google cannot find a way out of it, out of something that is giving them obviously bad image, that's really bad news. That means that integrating this type of fairness, in this case related to ethnicity, it's very difficult, if not impossible, to remove from their systems. Yeah. So, in the case of medicine, the point is that these real-world fairness challenges are not abstract; they are institutionally and contextually grounded. Yeah, and the point is that gender bias can be added to a machine learning model, for instance, just by biasing the choice of data. And sometimes we might not even be aware of it. Think about digital data in medicine that include textual data, electronic health records, EHRs. Yeah, how can we avoid those data, including whichever unfair biases? Extremely important, extremely impossible, And sometimes the problem, the lack of fairness, comes from actually trying to do something. Because what you do, like Google did, is remove the data that can become problematic, like age. You don't want to be unfair towards older people or younger people, you remove ethnicity, you remove sexuality, you remove disability from your data sets. Your analysis is going to be crippled. That's a trade-off you really have to deal with, If you don't use those data, you might not run into fairness problems or ethic problems, but if you remove them, you might completely screw up your actual data analysis. So this is something we have to deal with, and is by no means simple. So also, you might argue that the society at large is not ready to use artificial intelligence, for instance, in the medical domain, because it has been shown once and again that technology is still not quite ready. If you want to use this technology to somehow make better than actual human medical experts, you really have to guarantee full robustness of the system, amongst other things. That is still not the case. And ignore the hype about we got an artificial intelligence that got better than doctors at predicting this and that. No, it's not about that. You need artificial intelligences that deal in a very robust way in any conditions, not just for specific problems. Yeah, that's fine. If they do well there, fine, good for us. Yeah, but the point is that if you really want implementation, you need much more than that. And you might say, well, human doctors are not reliable 100% of the time. Yeah, but at least they are responsible for what they do. You cannot say the same for the machines, right? You could always say that government as such, governance as such, is not fully ready to take on artificial intelligence. And one of the reasons is because the law surrounding that is not ready either. So let's move now to the problem of legislation. It's extremely important in the medical sector, in the healthcare sector, because industrialization of artificial intelligence, as I said here, exposes it to legislation unavoidably, regulating the social domain in which they operate or want to operate. Yeah. And we need to ensure that artificial intelligence and medical and machine learning technologies comply with current legislation in the healthcare and medical domain. Point is, again, this is not obvious because artificial intelligence, as I've said about ethics, it was never developed quite with the idea of dealing with legal concerns. And that's kind of obvious right now. The GDPR from 2018, the European Union Regulation for Data Privacy, recognizes the right to explanation of any decisions made by automated or artificial intelligence algorithmic systems. And it talks about the idea of a data controller needed to deal with this. So who is the data controller? Yeah. Well, in public hospitals or in the NHS, is the public health trust or the regional health authority or the hospital corporate body. In private or university hospitals, there might be a legal corporate entity that deals with it. In primary care and independent general practitioners, in GPs, they might be actually, the individual practitioner might be the data controller, and therefore the person who is responsible for anything that legally goes wrong with the application of artificial intelligence. This has been around since 2018, yeah? And the implications are obvious. If you want to read about this, you have a QR for this paper here, EU Regulations on Algorithmic Decision Making and Right to Explanation, a very well-known paper by Goodman and Flaxman that talks about it. But also importantly, a few years ago, we started hearing about the immediate release of an Artificial Intelligence Act, regulating artificial intelligence in the European Union, right? And it's taking long, yeah, because they were, as it says here, milling about it, in 2020, but it's taken till 2025 for this Artificial Intelligence Act to go into full effect, yeah? And that's because in the middle, we got large language models that changed completely the landscape. And also we got plenty of lobbying from private companies. They didn't want their companies to get into something troubling, which is being tagged as high-risk artificial intelligence applications. Because in the AI Act, everything is regulated according to the level of risk. So if you are into high risk, your systems really need to comply with lots of things. If you are in an acceptable risk, forget about it. You're not going to be able, not even to implement it. If you're in limited risk instead, like chatbots, or minimal risk, like AI-enabled video games, you're out of the woods. But if you're in high risk, and most medical applications are in high risk, in the high risk level, you really need to comply with quite a few things. So that's for legislation. Then you have explainability and interpretability. And we have a big problem because with deep learning, and large language models are deep learning, yeah, in a fashion, models are extreme black boxes, very difficult to interpret, very difficult to explain. And in the medical sector, that's a killer. If you cannot explain the decision of a machine, of an artificial intelligence tool, if you cannot explain and interpret what this machine did, what this artificial intelligence algorithm did, you're done. I mean, only interpretable models can be explained, and explainability is absolutely paramount when anything related to decision making is involved. Yeah. So, I mean, we have been running lots of special sessions. If you're interested, I can give you information about this. I won't get into details about this topic because this topic has been central over the last, say, 10 years. Yeah. Again, one of these topics that people didn't care much about only 20 years ago, but suddenly it's everywhere. So, again, if you're interested in some information specifically about this, I recommend you this archive paper. I mean, it was written by a group of researchers from very different domains: machine learning specialists, data scientists, law specialists, philosophers, sociologists, right? And it's extremely interesting towards a rigorous science of interpretable machine learning. Also, we published, and again, you have a QR there in case you're interested. A couple of years ago, 3 years ago, in 2023, we published this paper in Neurocomputing called The Coming of Age of Interpretable and Explainable Machine Learning Models. One of the areas it covers, it's actually medicine and healthcare. Yeah. So I'm running out of time, so I won't get into detail about this, but the Artificial Intelligence Act requires lots of things about transparency and interpretability of models. Yeah. So this is the link between interpretability and legislations. There are transparency requirements. Users must be informed when interacting with an artificial intelligence. Artificial intelligence systems must disclose if content is generated or manipulated by an artificial intelligence. For high-risk artificial intelligence, developers must provide clear information about the capacities, limitations of the system, the envisaged finality, characteristics of the training data, and how decisions are made, and on the basis of what. Yeah. So we need high-risk AI systems that are sufficiently understandable and with human oversight and with technical documentation. Yeah, all these three things are absolutely important, because this explanation has to be made on non-technical terms to different stakeholders, authorities for auditing or regulatory purposes, to users to enable informed use, and to any affected person, patients, etc. Someone who, for instance, is denied a given treatment. Yeah. Again, human supervision and accountability has to be there. So the systems must be sufficiently interpretable so they allow meaningful human control, detect and correct or try to correct errors, biases, or misuses, and support accountability. Also, high-risk AI providers must provide documentation that includes model logic, input-output relationships, limitations, assumptions, and levels of the uncertainty involved, ways to interpret model behavior under different conditions. As you can see, if you're in high risk and any medical application for real is going to be high risk here, you need to comply with quite a few things, only in terms of interpretability. So they recommend to use different explainability tools. I'm sure you have heard many of them, Line, proxy models like decision trees or rule-based approximations, or model behavior visualization tools. So take-home message here is sufficiently understandable means that stakeholders, any stakeholder, yeah, not only the data scientists, must be able to understand the artificial intelligence behavior, understand its limitations, and trust its decisions, which is anything but trivial. Yeah. I think we could almost leave it here because I can tell you more things about this, but I mean, we will run out of time. I didn't get into privacy and anonymity, but that's also an important topic. Anyway, I will leave the presentation for you to share if you want between the among the audience, so that they can also read the rest of the things I had ready to talk about. Are you all right if we leave it here?
Yeah, sorry, I was muted. Yeah, thank you, Alfredo, for the job.
You're welcome.
Yeah, if you can send me the slides, we can
Yeah,
share. And
happy
we
to
have.
share them. Yeah.
Are there any questions in the room, or while you think about it, and we check also online? I have a comment, which
Yeah.
is really everything that you have talked, which is about large language models at the moment being free for access, probably because it's useful for companies to get additional data for free as well, as you said. But also people using large language models to ask mostly for questions that they wouldn't ask to some people, like medical questions.
Okay. You mean patients using them?
Sorry?
You mean patients using them, not just the medical expert, but also the patients,
Well, I
or the
don't know.
public in general?
Public in general, but probably patients as well, but I don't know. Yeah, but yeah, and I see that large language models are trained with all the data that is available, that it has
Yeah.
its own biases, and the objective of the large language model is only to try to make sense of the text. Well, to make text, which it means that it has all the biases of the data sets and everything. See that, I mean, this is like a whole other presentation to give about that topic, but do you
No,
have?
but it's really important because I perfectly remember this was like 3 years ago, just when ChatGPT had been released kind of big time, and I was giving this presentation to people in pneumology, right? And in the question time, there was this guy, a medical doctor, who said, "Well, I have made an experiment. I have put to ChatGPT all the symptoms of a given patient, and I have asked GPT. This was GPT-3. I have asked GPT to tell me potential diagnosis, a differential diagnosis. Yeah." And he said, "Well, I got like 4 or 5 potential diagnoses, and all of them made sense to me." And he said, they look like something written by a final year medical studies student. And he said also something interesting. 2 of those diagnoses, I hadn't thought about them. So basically what this guy was saying was, in the face of everybody, that he did trust. I mean, it was obvious that this guy fully trusted ChatGPT because it had given him reasonable answers. So the first thing I thought is, okay, fine. And it's good you use it that way. But at the same time, I thought, well, this tool is already sold. You know, this guy is going to trust it. Whatever, whatever happens, he's already going to trust it. And the same, he trusts it. Other people, other medical experts are going to trust it. And because I work with them, I know they use it. And they use it sometimes without asking themselves too many questions, because they see they are reasonably reliable. Yeah. And patients do the same thing. And the society in general is doing the same thing. I mean, they have symptoms, they ask ChatGPT or Gemini or whichever, or Claude or whichever large language model they are using. The point is, how can we ensure that all these people are using these tools reasonably, in a very well-informed way?
Yeah.
And it's an
Yeah.
open question. I don't have an answer for that. It's because at the same time, the field of large language models is evolving at an amazing speed. So whatever I tell today, maybe it's going to be wrong in a year time. So
yeah,
it's very complicated. But I mean, we are using them in our research to make explanations of predictions based by machine learning models. So we use an LLM to explain our black box models. Explain it linguistically. Not only that, but we make it explain it in different ways depending on whether you are the medical expert and you need a technical explanation, or you are a patient and then you need an understandable generic explanation.
Yeah. Yeah. Thanks for the answer. Any other questions? I mean, similar following. I mean, I'm not. If you want to follow on this similar topic, but do you see any circumventing the biases that the data contain on this context? Is it to have
Well, I mean, there are, I mean, in fact, several different metrics and measures of fairness have been defined. And you can actually, when you run your models, you can calculate these metrics and act in consequence. I mean, that doesn't mean you're going to avoid all biases and unfairness involved, but at least you can have a quantitative description on how fair your model is. In controlled circumstances, maybe not in general, but at least in controlled prediction circumstances. And the point is trying to convince people to use that. We have just published a thesis on that right now. And for that, what you need is a full analytical pipeline that takes these things into account. Not just the usual phases of an analytical pipeline, but phases that all of them have checked for fairness and biases in each of the steps. Difficult thing to do, but can be done.
No questions.
Tell them they are really boring people if they don't have any questions. How is it possible that they don't have any questions? What a public.
Yeah. I think, if I remember correctly, part of the abstract that you provided was more moving from AI-centric to data-centric or data science. Or...
Yes, that was at the end of my presentation. Yeah, it was data before AI. Yeah, it's like people love thinking in the techniques, in the machines, in the large language models, whatever. That's fine. People, get starstruck by these developments. But it's always very, very important to have control of the data and realize that whatever you can get out of AI is because your data are quality data. They don't include too many biases, and they are predictive. I mean, it doesn't really matter how sophisticated your machine learning or artificial intelligence tool is. The techniques you use, the models you use, doesn't matter, you use the state of the art. If your data are not good, you are screwed. Yeah. So we are data scientists, and if we call ourselves that, is because the center is on the data. Yeah. And Europe is doing big things, is taking big steps towards that. There is a Data Governance Act, yeah, a path, as they call it, to the digital decade, a Digital Markets Act, a Digital Services Act, and the Artificial Intelligence Act. Yeah. So altogether, you know, it's quite a big thing. I mean, from the point of view of regulation, of recommendations of what to do, etc. But also, you know, the point is that they are trying to get the data flow within the EU, but and importantly, across sectors. And they are creating common European data spaces. And that's very important, you know, transversal data repositories that are safe, are secure, you know, can deal with these problems. Making sure that they respect the GDPR, making sure that there is a flow of data across different sectors and different countries, which is extremely difficult. Yeah, I mean, sometimes even getting a data flow between hospitals is extremely difficult. Between regions in the same country is difficult. So between countries is even more difficult. So they're creating a horizontal framework for data governance. And data governance here, for me, is the key issue. You know, if we manage to get a cross-sectoral personal data space, you know, in which everybody can be sure that data are safe, that data are private, that data are anonymized, that they are not used in the wrong way, you know, then artificial intelligence can do marvels, you know, analyzing this data.
Yeah.
But really, it doesn't matter how sophisticated our artificial intelligence is if we don't take care of this data part. And for me, the data part is the cake, and the artificial intelligence is the icing of the cake, not the cake itself. You know, the data is truly the central thing. You know, this European health data space regulation. I mean, this is extremely important. You know, because there is a particular space for health data. This was one of the dreams of the Human Brain Project. They didn't get it through. Yeah. This European health data space regulation came later, yeah, but it's still here, and I'm sorry to say, I'm really truly sorry that the UK is not in the European Union any longer. But I mean, these sort of things should be taken care of. Doesn't matter whether you are in the EU or not.
Yeah. Okay. We are running out of time, but thank you for all your answers. Thank you for presenting these great experiences of AI and data.
It was a pleasure.